So for those that are joining us, welcome to Kamiyama Physical Therapy. For those that are seeing the replay who have registered, welcome as well for the first time for Kamiyama Physical Therapy. Those that are joining us, you are going to be muted, so the audio quality is going to be good. My name is Kento, and the other side, there's Danny over there with the headphones on. We are the team of Kamiyama Physical Therapy in Tenafly, New Jersey. And this is a webinar for individuals that are having sciatica issues. So this is a webinar for 5 simple tips for sciatica. So this webinar is for you if you're an active 35 to 60-year-old who is not able to work out due to sciatica pain. You're active, you're into yoga, you're into Pilates. Right now, especially with the COVID-19 virus quarantine, you're doing a lot of things at home because we can't go to the gym. We talked to Solana a little bit just now about it. And if you're having trouble with it, this webinar is perfectly for you because we're giving you stuff that you can do at home. If you are working from home, you're currently having pain and that's affecting your job because you have to sit for a long time, or you just have to, you can't really do stuff where around the house where you can't carry stuff, you can't pick up something, and the day-to-day issues are having impact in your life. In the past, if you had sciatica pain and you went to a doctor's office, you were given pills or told to just rest. And you want to find like natural ways to help your sciatica pain. This is the webinar for you. With the COVID quarantine, you're having trouble, having time, having quality time with your family, or not being able to do outdoor activities. This is for you too, because you want to be able to do these things. I have a little story about my father that I did in several webinars ago. And he was in pain for about 4 weeks without telling me. And if he just told me, he could have still been able to run or enjoy outdoor activities and gardening. If you hear my kids kind of yelling in the background, I apologize. This microphone that I have catches everything. But at least they're healthy and yelling at the same time. And also the last thing is, if you're afraid of going to see the doctor right now due to the COVID-19 precautions, this webinar is perfectly for you, so you can do these things on your own and talk to us a little bit in order to give us the ability to help you, guide you a little bit more. So let's go into a little further, and we're going to talk a little bit more about the emails. Something's going on with Sandy right now. Great. Sorry, guys. Oh, no, she's back. She knows.
There you go.
All right, and seeing coming back, guys. So now, so if you are new to this webinar, and we've been doing webinars every week since the quarantine. We've been doing once a week, so we have 8, and we're probably going to have more and more. We're probably, probably our goal is forever until the quarantine is over. So we've done a lot at this point. So if you are interested in being being on the email list for future webinars that is a little bit more about other body parts and a little bit advanced, please email us to kind of join, because these are free at no cost, and you get to kind of join us and get to know about your body parts that maybe you're having trouble with. We've done neck, we've done hips, ankle instabilities if you've been like a soccer or lacrosse or any player that has a lot of ankle instabilities, knee pain, shoulder instabilities, sciatica impingements, a lot more. So please join us if you'd love to. It's been a really good ride so far. So let's go into a little bit about myself. I am the owner of Kamiyama Physical Therapy. Partner Danny is over there on the other side. We are physical therapists legally, and we treat treat individuals holistically very well. So we really enjoy talking to or treating individuals not just with body parts but as a whole. We strongly believe that as we get older, we have other things in our life, medical history, knee injuries, maybe a back surgery that will have contributions to everything else. So we really like to treat the individual as a whole and work from there. I love reading. I really enjoy going deep into topics. So in a sense, like you want to master your craft in order to help other people. And I love spending time with my kids and my wife. You can see the picture on the right. My daughter is bothering me every single time I'm working out, and my son kind of smiling. He bothers me a lot too. For whatever reason, just a good picture came out of this. and my wife is with my daughter in that other picture. So enough about me. I'm gonna have Danny take over because he's gonna be the one that's gonna be teaching here. Danny, take it over.
Thank you, Kento. Thank everyone for joining us. And I think you kids never bother you. They're so nice. But anyways, my name is Danny Burbano, physical therapy assistant, and I'm also an acupuncturist in New York. And I'm also lucky to be an adjunct professor for Seton Hall University to teach anatomy for both the physical therapy and physician assistant program. And of course, just like Kento said, I think that's how we get along to great along. Is like that we both look at the body holistically, and then we both love to kind of like keep digging for that truth. You know, what's really going on behind the body? Where is it coming from? And I think that might be the reason why I like taking things apart and then like fixing cars and all of that, because I just love fixing stuff, you know. And of course, I love spending time with my wife, that you can see from the picture. But just like Kento said before, we wanted to create this webinar just to help you understand more about sciatica and then what is really going on with you. How come it hasn't gone away? How come you're still having it? So of course, you know, the exercises, you know, there's not just one exercise that can fix all sciatica problems. So if you have any specific questions, any specific concerns, anything that you really want to talk to us privately, feel free to give us a call. Feel free to give us an email. You know, don't we're here to help you out. We're here to, you know, we listen to you, we hear you, you know. So make sure you take action, and you don't have to be in pain anymore. So just give us a call. It doesn't have to be us, but just talk to any health professional out there. Now today, of course, we're going to be talking about sciatica, 5 simple tips to relieve sciatica at home. So we're going to be reviewing about anatomy, of a little bit of just basic concepts. So of course, we're going to explain the impingements, what is an impingement, and the common sites of impingements. And of course, we're also going to show you the 5 simple exercises that you can do at home. So in order to understand more about sciatica, we need to understand the anatomy of it, right? So as you can see from the picture here, sciatica is the largest nerve in the body. It starts in the low back. So actually, let me use a little pointer so you can see. It starts around this level. Actually, let me change the color for that. Maybe a brighter color. So it starts at this level in the low back, and then it exits around the buttocks area, and then it travels in the back of your leg. Right before it gets to the knee level, it's going to split into smaller branches. It's going to go down all the way down to your foot. So as you can see here, it's a large, very, very large nerve actually. So the main job is going to be to activate or turn those muscles on and off in the back of the thigh and all the way down to the foot. The other function of the sciatic nerve is going to provide sensory input below the knee, meaning it's going to help you kind of feel that below the knee and all the way to the foot. That's what, like, some people might get the numbing and tingling down the foot. So as you can see, it is a large nerve that goes all the way from the back, from the low back, all the way down to the foot. So it's going to go in and out of muscles, as you can see from here, as you can see it here, and all the way down to the feet. So because it's crossing so many muscles, it's crossing so many joints, it's going to be susceptible to impingements. What does that mean? So let me show you what that means. So let me take you to the next slide. An impingement. What is an impingement? So if you can imagine a water hose, right? When it's brand new, you just buy it, get it from Home Depot, Lowe's, you connect it, and it's like there's a nice strong flow of water. So imagine that water hose getting kinked. Then the flow of water is going to be affected, in those areas down at the end of the water hose would not get water, right? Those areas that are basically around the kink will lose the flow of water, will lose the pressure. So if you take that concept and you take it to the nerve, the sciatic nerve, it's gonna lead to changes in dermatome muscles, or meaning it's gonna lead to that numbing, tingling down the leg, or it's gonna lead to that basically the muscles kind of like cramping or in pain or not working for you, which is gonna lead to more and more issues. So in other words, an impingement is any kind of compression around the nerve. And there's gonna be many, many sites that the nerve can get compressed, because remember from the previous slide, the nerve is very, very large. It starts in the low back and it goes all the way down to the foot. So let's learn about those site of impingements so we can better learn about how to treat it. So the sites, they're not in a specific order. of intensity. It's just saying I'm just doing it from the top down. So if you take a look at the first one is going to be something that you probably heard before. It's going to be a bulging disc or herniated disc. So the question is, what is a disc? The disc is going to be like a jelly-like substance between each level of the spine. So basically around here. So there's going to be like a gel-like substance, right? So that gel is going to help separate those bones, if you want to think about it, allowing the nerve to exit between those bones, as you can see here. But when that jelly wears out or slips out, it's going to start compressing that nerve, getting that impingement that we talked about before. So that's the first one. The second one is going to be spinal stenosis. It's something similar, but this involves more of the, not necessarily the gel, but it's more of the canal or tunnel that the nerve uses to exit from the low back or the spine all the way down to your leg, as you can see here. So what happens when that tunnel gets compressed due to hormonal issues, vitamins, and all of that, that's going to start compressing and kinking that nerve, as you can see here. So that will be the second one. The third one. So the third one is going to be something that you probably heard before too. It's called SI joint symptoms, meaning like it's because the sacrum is involved around here. The sacrum is this bone right here. And then with this bone, it starts twisting or is positioned in an awkward way due to compensations and all of that. What happens is going to start creating tension all around this low back area. When there's a lot of tension, there's a chance that things are going to get kinked or impinged, just like the water hose that we talked about before. Now, the fourth one is going to be something called piriformis muscle or piriformis syndrome of muscle. So basically, the piriformis is this muscle right here. Let me actually take this out here. And the piriformis is this muscle right here highlighted in yellow. It's a tiny muscle that's like deep in the hip. But the main function of that muscle is going to help rotate the leg. It's going to help you rotate this whole leg, right? What happens is when that muscle gets tight due to compensation, it's going to start pressing on that nerve, which is right here. It's going to start choking, pressing, kinking that nerve. So you can see, like, if the nerve gets kinky here, you're going to have issues down the chain. All right, so let me take you to now more. Let me take this away first. Now that you know the common sites of impingements, now let's dive into the 5 tips that we promised. The 5 tips is really sciatica at home. But before we go on, please note that this webinar is not just a physical therapy session, and this is not a specific medical advice, but just rather more general information. So we hope that you guys can learn from it and that it can help you in your recovery. So the first one. The first exercise that you can actually do at home before you go to bed or when you wake up is for those who have a hard time standing up straight. So this is something super simple. You don't need any equipment, and it is going to involve laying on your stomach, and it's only going to take 5 minutes of your time. So the first thing is you can do is just lay on your stomach in a comfortable place. It could be the floor, a mat, or it could be your bed. So you can use a pillow even under your belly if it's more comfortable for your spine. But the whole idea is you want to lay down in that position, and you're asking, oh, how does that going to help me? So remember what we said before in the common side of impingements, where that jelly-like substance slips out and then it starts pressing on that nerve. What happens is this position is actually going to decompress that area. It's going to decompress that jelly. If the jelly is decompressed, the nerve is going to have less pressure. So you're going to have less symptoms. The whole idea is if you're having symptoms down your leg, so let me show you here. If you're having symptoms down your leg, you want the symptoms to go back up to kind of like, instead of having a wide range or wide area of pain, you want to have a smaller area of pain. So you can do this for 5 minutes, like I said. But if you really like, the competitive type and then you just want to like, really dig into it, you can actually do the progression of this exercise, which is going to be just like the picture that we have in here. You're going to keep you're gonna be in the same starting position, which is behind your belly, right? Then you're gonna be doing a push-up with your arms. The main thing is to remember that your whole body, your back and your legs are gonna be relaxed. They're gonna be nice and soft. All the pushing is gonna come from your arms right here. So your arms are gonna keep pushing you up and bringing you down again, pushing you up and bringing you down. So you can do this like 10 repetitions, see how that feels. Then you can do another 10 repetitions and see how that feels. But don't do it for more than 5 minutes. Why? Because what's going to happen is like as you keep doing it, your arms are going to get tired. And if your arms get tired, then you're going to start using other muscles to try to compensate for that. Then you're going to start using your neck muscles, your upper back muscles. And we don't want to build any new compensations, right? We want to take away pain or that discomfort. So make sure you just keep it for 5 minutes at a time. All right, so it's super, super nice and simple. So now that you know one simple exercise you can do it on your stomach, let me show you the second one. So the second one is going to be something similar, but it's something that you can do at work, on the go. If you're traveling in the city or in the subway, if you're at work, you just grab a corner in your office and just do it. So this is a progression of the previous exercise. So this is actually like a preview or one of the videos or helpful videos that Kento was sending you before that we have on our channel. You can find, I think it just takes like about 2 minutes. But let me show you a little bit. I don't think you can hear it, but I'm gonna show you, I'm gonna play it, and then I'm gonna explain it for you. From here, just watch it. Now, as you saw there, I'm gonna take this away and I'm gonna use this. As you see, it's the same thing as extending your back, trying to relieve that tension around that disc, that jelly-like substance that we talked about. But the main action is, or the force, is gonna come from your arm. Just like you were doing the press up before, right? You were doing that push up from your bed or from the floor. This is, you're gonna be using the same arm or the same force to try to push your pelvis or your hips forward. So it's all gonna come from your arms. All right, so it's gonna be the same motion, bringing the hip forward or bringing the spine forward. All right, so this will be the second one. You can actually do it on the go. And the same thing, you just do 10 repetitions at a time, no more than 5 minutes, and see how that feels. See if that relieves some of the numbing and tingling sensation down your leg, and then it brings it back up more towards to be centralized, more like in your low back instead of being around your whole body. So that's the second one. So let me show you now the third one. And the third one is going to be something we call something nerve flossing. So basically nerve flossing is more almost like, like freeing up the nerve or like loosening up the nerve. It's not the same thing as the flossing of the little dance that kids are doing side to side. I don't know how to do it. Maybe Kento knows with his kids. But this is going to be loosening up that nerve. And again, this is one of our videos on our channels. So let me play it for you and then I'm going to explain it. So you can see from here, the whole exercise is stretch the nerve. There's like a lot of anatomy behind it, but the main thing is you're gonna sit up in the chair, you're gonna kick your leg forward or your foot forward, and then you're gonna bring your neck forward. The second part of the exercise is you're gonna kick back and bring your neck back. It's nice and simple. So what it's gonna do is it's gonna stretch that nerve and it's gonna loosen up that nerve. So remember, it's two parts. You sit up at the chair, you kick your leg forward, which is right here, and then you bring your head forward. And the second part is you kick back. Let me see here. You kick back, and then you bring your head back. Nice and simple, same thing, no more than 5 minutes. See how that feels around your back. See if that helps you release the symptoms or some numbing and tingling down your leg. So let me take you to the third one. So the third one is going to be involving that muscle that we talked about in the anatomy part. Remember that muscle called the piriformis, the one that was deep around your hips? So for this one, you're gonna, if that muscle, if you're getting that pain around your hips, right? If you're getting that pain around the hips after sitting or after walking for a long time, and then that pain later starts developing or increasing or in intensity that now you feel it down your leg, it might be that muscle. But so the main thing is you're gonna be nice and relaxed, right? So the most comfortable position is gonna be on your back. So you're gonna lay down your back, then you're gonna cross your leg by placing the leg that hurts onto the opposite side thigh. So in this case, my right leg is the one that hurts, the one that has the sciatic nerve. So let me actually point it out for you. So this is the sciatic nerve that I want to stretch. So I'm gonna fold that leg or bend that leg and bring it across, almost like I'm crossing my legs, right? And then from there, I'm gonna bring this knee, this whole leg up. What that's gonna do is gonna stretch this muscle that's right here. Remember the piriformis muscle that we saw earlier, the deep in the hip? By staying in this position or getting into this position, it's gonna allow the muscle to open up or stretch. Same thing, you're gonna do it for about 10 repetitions, no more than 5 minutes, and see how that feels. It's gonna feel, from experience from myself and other patients, is gonna feel like a deep kind of stretch, something like you really haven't felt before. But make sure it's, of course, not too painful, because you don't want to push through much pain. All right, so that will be the fourth one. Let me take you to the fifth one. The fifth one is going to be something simple that we all do throughout the day. However, this is going to be more focused on relaxation. So this exercise will actually relieve the pressure on your low back and actually engage those deep core muscles. How? Because those deep core muscles, actually, they help you for breathing. So the first thing you're going to do is you're going to lay on your back with your feet up on a chair or on a couch or wherever you want, as long as it's high enough so your feet can relax in here, as you can see from the arrow. Next thing you're going to do is you're going to loosen up your whole body, your neck, especially in your neck, because a lot of people tend to feel that pressure around the neck. Then you're going to take a deep breath in through your nose. Then you're going to exhale all the way out through your mouth, nice and quietly. So the simple way that I always tell my clients is if you breathe in for 30 seconds, breathe out for 60 seconds. So if you breathe in for on a count of 3, 1, 2, 3, make sure you breathe out 1, 2, 3, 4, 5, 6. Make sure you prolong that exhale. The more that you prolong it, and the more that you lessen the tension across your whole body, it's gonna help you relax the low back. It's gonna help you kind of wake up those core muscles. And of course, the more we breathe, doesn't matter what kind of technique we use across, breathing helps us relax. This is going to help you relax your whole body and mind, almost like a meditation. But it's also going to allow your core muscles to engage. So again, it's no more than you should do it for about 5 minutes at a time. So those were the 5 most common exercises that you can relieve sciatica at home. So we hope that that was helpful and that you feel a little bit less fearful about sciatica, because we know a lot of the times a lot of our clients come in and then tell us they're fearful and frustrated that it hasn't gone away, that they just need to find a solution. So the reality is also that if you're still in pain and you try these exercises at home before, that you try Googling before and you're going online and you found this exercise and it hasn't worked, or if you're still feeling tightness around the hips despite trying similar exercises in the past, and that frustration is just building up because there's not that much progress, and then you can get that fear, is this gonna ever go away? maybe it's time for you, like we said before, it's time for you to talk to a professional and find out a specific exercise for you. Because as we know, like an effective plan of care, we need to build around a specific need. So the best route is always to talk to a health professional to build a program around you. And of course, like in these times of need, and then everyone is freaking out, and then I think Kento and I, we were talking about before, it's like we all need to help each other. And I think a way to help you guys out is by giving you like a complimentary virtual session. And then we want to give you like it's going to take about 20 to 30 minutes, but we want to make sure like we look at your whole body and do a whole movement assessment to make sure to see things in how you're moving and your habits, and of course to answer any specific questions that you may have, any specific frustration. You can tell us about what you try, what you haven't tried, so we can give you a route or options for you. Just know that there is an option. There is ways to help you out. Don't feel like there's no more uh, help for you. Like Kento was saying, don't feel like you have to take pills for the rest of your life. Don't feel like you have to be resting for the rest of your life. There's options out there. So feel free to call us or email us, and we can give you that complimentary virtual session. No strings attached, of course. We just want to help you guys out. Information is there, 201-305-9665, or you can email us directly at info@kamiyamapt.com. And I think at this time we want to open up the forum to like a Q&A time. What do you think, Kento?
Yeah, Danny, thank you so much. Yeah, it's a